My topic is about the issues of how can we improve the outcomes of allogeneic transplantation after allogeneic transplantation in AML. Actually, you know very well there are over 60 years of long history of allogeneic transplantation in the world. Even in Asian countries, there are 40 or 50 years long history of allogeneic transplantation for or against various hematology malignancies. So I'd like to focus on the adult AML issues today. So you know very well there are many kinds of complications after allogeneic transplantation, including the underlying disease relapse and issues of many kinds of infectious complications, and focusing on the acute and chronic GvHD. So people are trying to overcome many kinds of these complications before and after transplantation, but not perfect yet. So the first issue is about the relapse issues for high-risk AML patients. So there are many kinds of trials to demonstrate the effect of the far advanced tools such as the immunogenic immunomodulatory drugs or the anti-leukemic or specific CTLs, or even nowadays a kind of CAR T cells or CAR NK cells, but in trials yet. So I'd like to speak about the issues of the anti-leukemic CTLs or CAR T cells or CAR NK cells briefly. So first issue is about the anti-leukemic CTLs. The main target was the Williams tumor gene 1. So WT1 specific CTLs were adopted even in late 1990s, and issues of these complicating anti-leukemic CTLs are widely distributed in the world. And for in Korea, the first reports about these anti-WT1 specific leukemic CTLs are against the high-risk AML patients. The total number is 10, and they followed up almost 9 or 10 years. Now recently published about the final outcomes, and they show the around 71% of a long-term event-free survival rates after infusion of the anti-leukemic WT1 specific CTLs after allogeneic transplantation. But unfortunately, some of them died due to the complicated GvHD or the relapse of the underlying disease. So it's not perfect yet, but we could enhance these kind of anti-leukemic immunotherapy using various kinds of CAR T or CAR NK cells in the near future. And the other issues about the complications of infectious diseases, such as CMV or adenovirus or some kind of more complicated multiple viral infections. So nowadays, even in this ASH meeting, some pilot trials are introduced about the multiple antiviral specific CTLs, even after transplantation, including the anti-CMV or anti-EBV or anti-adenoviral specific CTLs. And the most interesting issues about the haploidentical transplantation setting. They also introduce a kind of suicidal gene, such as caspase suicidal gene containing CTLs after transplantation. So it's very optimistic to be overcome some kind of more detrimental GvHD something issues. But this kind of trials are still ongoing. So we are expecting more optimistic results in the future. And the other issue is about how could we lessen the GvHD, including acute and chronic GvHD. So we could also modify the conditioning regimens or the GvHD prophylaxis using many kinds of the tools, so including I mentioned before the genetically modified T cells, kind of T cell depletion method, but also it's very anticipating to see this kind of approach in the future. So taking all these kinds of approaches, we could anticipate more optimistic and more favorable outcomes in the near future. But I'm not sure whether we could indicate the allogeneic transplantation for all kinds of hematologic malignancies. So finally, these days, you know very well, the issues of MRD, minimal residual disease, is also very important to be considered before and after transplantation. And the timing and the lengthening of the follow-up duration is another issue. But anyway, the MRD is very important to predict the relapse probability of these high-risk AML patients. So we could be enhancing the tools of these kind of MRD-based approaches, such as NGS techniques or flow or NGS combination. Also could be a very good approach to predict this kind of the probable relapse patients. So we can enhance these enhance the immune power of these the relapse patients using more fascinating immunomodulatory tools, including the cells, genetically engineered TCR cells or CAR cells, etc.